So a patient who would come with some amount of lower abdomen pain, bleeding. So these are some signs which tell us this could be a miscarriage. So there is nothing like being extra careful in any trimester. So in the first trimester, one has to have a diagnosis that the pregnancy is inside the uterus. It should not be at a different site other than the uterus. The baby's heartbeat should have been checked. The second trimester, one has to find out that the baby is growing normally. We also want to find out that the baby's organs are well formed. In the third trimester, there are other complications which can come in. Like somebody can have a high blood pressure, somebody can have a high sugar level, the baby's growth can be restricted. So again, certain things have to be noted. So there's nothing like being careful in any trimester. Throughout the pregnancy, one has to watch out for certain signs and get their regular checkups done. That is what is important. So what is called a silent miscarriage, what you're calling a silent miscarriage, is also what is called a missed abortion.
Okay.
So that means the baby stopped growing in utero and the patient doesn't know about it. So this can happen sometimes when we check on ultrasound. Let's say a patient has gone for her level 1 ultrasound at 12 weeks, and on ultrasound the doctor finds out that the baby is not growing. So that is what a missed miscarriage could be. So it's not that one can avoid a miscarriage, but yes, before one gets pregnant, one should get a few tests done to find out that her body is fit for the pregnancy. Like a rubella check should be done. So one should check that she is immune to rubella. There should be a check on the sugars of the mother. So the sugars of the mother should be normal before she conceives. Her thyroid should be checked. So these things, if the basic things have been checked, then the chances of a miscarriage would be less. At least the miscarriage that would happen because of medical problems in the mother would be less. Ectopic, by the name, by the word itself, means that it is something other than normal. So the location of the pregnancy is not in the normal site, but at an abnormal site. That is why it is called an ectopic pregnancy. Yes, to some extent, I would say yes to it. So if the patient has had an ectopic pregnancy and the ectopic has ruptured, then she might have spoiled her tube. So then her chances of conception might go down with that. So placental abruption means that the placenta for some patients can separate from the uterus. That means the placenta, between the placenta and the uterus there is a blood collection and the placenta has separated from the uterus. These conditions can happen as an emergency situation for some people, and the problem with this is that the baby and the mother both can be at a risk because of something like this happening. So if somebody has a severe pain in the abdomen during a pregnancy, it's better to take medical help as early as possible.